Hello, I'm Adam Shulberg, Senior Audiologist at Cubex Audiology here in central London, and welcome to your weekly tip. Today I'd like to talk to you about audition and cognition. So cognition is a bit of a buzzword at the moment. You'll hear it referenced and spoken about in different spheres. But in audiology, it's something that has been spoken about for something like 70 years actually. And the relationship between the two is absolutely critical. They are completely intertwined. Hearing is passive, so the sound enters through the ear canal, through the eardrums, makes the three little bones vibrate. In turn, that stimulates the inner ear and messages are sent up to the brain. In actual fact, it's not a particularly complex process, but what happens after that is very, very complex indeed. As those signals reach the brain, that's where interpretation starts to happen. You start to make sense of sound. So if there is any reduction in hearing sensitivity, you become very reliant on your brain as a resource to fill in the gaps. And if your brain is compromised in any way, if there's been any cognitive decline, even if you're tired, anxious, or if there are other things happening in your life, it can become difficult to focus. But also with hearing, when hearing declines, there'll be missing bits of information. And this is the critical part, because your brain then has to fill in the gaps using your working memory, using episodic memory, using attention. And so clearly if any of those are compromised or affected in any way, then it is going to impact on the way that you interpret the information. So in our clinic, we look very carefully at cognition as part of our protocol when we're assessing patients. It's really important that we understand what is happening and how the memory is impacted on, and how those other skills that are so important for interpretation and understanding. So this is something that we do routinely. We don't just look at hearing in isolation, we look at the cognitive skills, and that's something that is then blended into the program that we'll then deliver. So cognition and cognition testing is a very important aspect, something that we work into our rehabilitation, and we constantly revisit to make sure that cognition is strengthened, and that the patient and their family and friends are able to communicate with as little impact and as little effort as possible. So what I'd like you to do, please, is to visit our website. There's lots more information on there regarding this topic. Alternatively, if you'd like to give us a call, even arrange to come and see us in clinic, we'd be delighted to share some more information with you. The website address is www.cubex.co.uk, and thank you very much for listening to your weekly tip.